Hello everyone and welcome to this new orientation session. This is Ahmed Hamdi, iCourses founder and instructor, and I'm very pleased to be with you today to discuss the FRCS problem solving exam that belongs to the Royal College of Surgeons of Glasgow. So, if you are preparing for this test, if you need more information about this test, then this lecture will be for you. So, let's get started. Today's session will be consist of three main parts. So we first go over and through an overview of this exam. We will discuss the structure for this exam, and we will know how does this exam looks like, what are the eligibility criteria, and what are the exams that may exempt you from the first part, so that you can proceed to the FRCS part 2 directly, and other informations related to this exam. So this part will be like a complementary part to the Road to UK Ophthalmology lectures, and also to the UK Ophthalmology exams blueprint lecture. So if you didn't check them on the YouTube, please refer to that. Then we will go to the second part of the lecture, which is the exam preparation. We will review the important study resources that you may consider for preparing for this exam. We will discuss some important tips and tricks that will be useful for passing this exam. And finally, we will go to, or we will reach our course, and what is the course that we will provide in order to support your study and support your preparation for this exam. So let's start by the FRCS problem solving exam, which is an overview and the structure of the exam. The exam has certain eligibility criteria. So you need to pass any of the following exams in order to be eligible for the FRCS Part 2 exam. The FRCS Glasgow Part 1, or the ICO Basic Sciences and Optics, or the FRCS Part 1, or the FRCS Edinburgh Part 1. If you pass any of these exams, then you will be eligible to apply for the Part 2 directly, which is the FRCS Glasgow Part 2, consisting from a problem solving exam and the MCQ exam. However, if you pass the ICO clinical, then you will be exempted from the clinical part, or the clinical MCQ part of the second FRCS Glasgow. So you will be able to sit for the problem solving directly. So if you have any one of these exams, you will be exempted from the first part. Also, this is regarding the exams eligibility. Regarding the experience eligibility, you should have 4 to 4 years and a half year of ophthalmology experience after internship. So this is after you finish your internship, you should already completed 4 years and a half in order to be eligible to apply for this exam. And one important thing to note here is that this eligibility should be applicable at the time of application, not at the time of doing the exam itself. So keep that in mind, that at time of application you should have 4 years and 6 months of ophthalmology experience. This experience can be at any level, at a level of senior house officer, at a registrar, at a resident, at a specialist, at a consultant, whatever. This doesn't matter for the exam. You should only have this like a time interval of experience. It's also important to note that you have maximum number of attempts for this exam of 6 times. So if you are just applying for this exam, you need to know how many times that you can apply. But the good news that it is not strictly 6, because if you even consumed all your 6 attempts and you still need to reapply for this exam, then the Royal College of Surgeons of Glasgow has mentioned that you have like certain conditions that they can consider your application, that you already progressed in your clinical practice, progressed in clinical experience, and this should be documented. Like you should apply with a document from your clinical supervisor or your clinical educator or your residency program supervisor, whoever is supervising your training, that you have already enough experience and you are increasing your clinical skills and increase your practice, so that when you are applying for this exam you are more likely to pass. So of course we don't say that you should apply for 6 times, we don't even think of that, but this is just in case if you need to know this piece of information. And just I wanted to I mentioned it because I want to stress that this is not strictly 6, you can still apply after that. Okay, so what are the recent updates regarding this exam? As we told in the Road to UK ophthalmology exams and in the UK ophthalmology exams the blueprint lecture, the recent updates regarding this exam that it is now conducted online. So due to the COVID-19 crisis, it will be now conducted online all over the world. And nobody knows actually could be a blessing or a curse, this could be advantage or disadvantage. You can think of it like yourself. So from my opinion, it is an advantage. But let's say what are the advantages or disadvantages of having the problem solving course or having the problem solving exam in online. First of all, it will be you are saving your travel costs. Like you don't need to travel to an exam center, and you can just do the exam at the comfort of your home. No hassle, no cost of travel. So not every country has an exam center for the FRCS Glasgow, and this option or this availability of online exam made a huge difference for the feasibility for this exam. But unfortunately, nothing comes without disadvantage. So the disadvantage for this exam that, or for being conducted online, that you have to make sure that you have very reliable internet connection. So let me be honest with you. I had one of my colleagues who already did this exam online, and due to some issues with the internet connection, he had to restart the exam and he lost a valuable time, and then he didn't manage to complete this exam, the whole scenarios of this exam. So he unfortunately didn't pass. So but I think that you can manage that. Like if you are if you in some countries there are some certain private halls that are dedicated for doing international exams. Like they are equipped with good laptops, they are equipped with high speed internet connection, with even multiple lines of internet connection. So if you just ask about that, they will be like a reliable option to, so that you can go to these halls and do the exam at their centers. You don't have to do the exam at your home if you are not very trusting your internet connection. Okay, and it's also needless to say that this is like, and you are doing the online exam under strictly exam conditions. So you should open the camera, you should open the mic, and because you are under surveillance all the time. And you don't worry about all that, you will receive all instructions from the Royal College of Surgeons of Glasgow, and you will be trained how to use the online platform where you are going to conduct the exam. So this will be the last thing you should worry about, just to focus on your study. So let's now review what is the exam structure. How is the exam looks like? Well, the exam, first of all, the exam duration is 2 hours and 15 minutes. And if you ask my opinion about if this time is enough or not, well, I believe that it is more than enough. If you read the scenarios, you can attempt the scenarios in the allocated time, and you will even have time left for revision. So what are the structure of this exam? The exam consists of 4 clinical scenarios. 3 of them are for clinical ophthalmology, and 1 of them is in emergency medicine. And this sometimes can be considered by some of us a drawback for this exam, to have an emergency medicine question that is not related to ophthalmology. But for some reason, those of the Royal College of Surgeons of Glasgow believe that you are not treating the eye alone. You are a physician who is treating the patients as a whole, so eye is not an isolation from the other parts of the body. So you need to know like the basic emergency. You need to know how to manage an emergency condition. But they still know that you are an ophthalmologist, so they don't make this question difficult on purpose. So as I will show you, these questions tend to repeat and the scenarios tend to be familiar to us. Okay, so regarding the exam, so if you are trying to plan your time, then you should, if you are just allocating the time equally to all these questions, so we will just give like 30 minutes for each question. This will be like 30 minutes for the first scenario, 30 minutes for the second scenario, and so on. And you can see now you can finish the exam in 2 hours, so you will have 15 minutes left for revision. So this will be like you have to plan your time well for this exam, as I'm going to discuss at the end of this lecture. So what else do we need to know about this exam? Well, the exam had an old format and a new format. For example, for instance, like the old format is like till 2014, and after 2014 there was a new format. So what is the difference between the old format and the new format, or what is the difference between the old system and the new system? Well, it is not a matter of number of questions, or it is not a matter of duration of the exam, but it is just the structure of the exam. In other terms, before 2015, like till 2014, the question scenarios were broad, so they will ask you for management, and you will be left to discuss freely by your own opinion and by your own ideas, which how to approach this question. But nowadays, after 2014, the exam questions are becoming more specific. So they ask you about specific items. Like they ask you, for example, about symptoms or signs or investigations or treatment or risk factors or etiology and so on. So is this like advantage or disadvantage? Well, first of all, it's a fact. So we have to accept it. But whether it is an advantage or disadvantage, well, we can have a debate. Like in the past, when you had this exam, which consists of 4 scenarios or 3 scenarios, where you can find every scenario with just asking about the management, and you are free to discuss how would you approach this question. This will leave you much space for your imagination. You can approach the question however you like, or whatever you like. And the advantage about that if you miss something, or if you forget to mention something because the question will be large, like in 4 or 5 pages, then you will this can be slipped beneath the notice of the examiner or the one who will correct your answer. Maybe he didn't focus on this part particularly. However, nowadays on the new for exam system, then you will be asked about specific questions. So you need to address each question. You can't hide. You have to face each question. If you just forget something, you will lose marks. Okay, so this will be like a disadvantage. But on the other hand, when you are doing the old system format, like if you are just writing 3 or 4 pages, and it is more likely that you will forget something, because maybe you are from the stress of the exam, you can't organize your thoughts, and you may miss the differential diagnosis, you may miss to write the investigations, so you can lose marks for that. But now in the new system, you are asked specifically about investigations or treatment or whatever, so mostly you will not forget, and you will not miss anything. And also the virtue of the new system, that it will just an easy way to collect marks. Like if you know something but if you know a question but you don't know the other question, then you can still gain some marks from the question that you know. So this will be like very important and will be collecting marks. And to my mind, that it is like an upgrade for this exam, because actually this was how the emergency medicine questions were formulated in the past, even in the old system. the emergency medicine questions was made into 3 or 4 or 5 even sub questions or small questions, so that you can answer each question separately, and this will make you again gain marks. So they try to make it more easy by making the ophthalmology questions the same as the emergency questions. So I hope that this is clear. So we will come to that, the difference between the old and the new system now, for as we were talking about the exams preparation. So how can we prepare for this exam? There is no single one solution fits all for the exam preparation, because actually the most important asset for your preparation will be your clinical practice. And since many of us have very variation or wide variation in their clinical exposure, in how much they got trained in their home countries, especially those who are in the developing countries, they may not have this well structured and strong training program in their residency or even after they become resident. So sometimes this will be a problem. So how can we prepare for this exam despite the fact of, or regardless of our training? Then you need to complement your training with the study. So what are the study resources that we can we can use for this exam? Well, since that you are in your clinical practice, you are seeing clinical cases, so you will learn how to detect the signs, to analyze symptoms, to take history from the patient, and to order investigations, and to see what is the relevance of these investigations, and then formulate a differential diagnosis, and then formulate a management plan. Well, this will be the same thing that you need in order to succeed in this exam. You need to have a plan, and if you don't have good clinical experience, then the other workaround will be to gain this clinical experience from books. So these kinds of books are case reviews books that will discuss clinical scenarios and show you some photos, some signs, and ask you about them, and then will go with you step by step through this exam or through this scenario until we reach a final plan of management and investigations and treatment and so on. So what are these kinds of books? We have two main books. The first one is called the Ophthalmology Review, a case study approach by Kuldeep Singh, William Smithy, and Andrew Lee. This book I told about in the last December 2020, and in my lecture in the Road to UK, and my candidates followed the advice and already studied from this book, and they told me that they found that it will be the most helpful for the exam. So this question or this book is very valuable for the exam, and I recommend it a lot. The second book is a very famous book for those who are attending or applying for the final FRCS exam, like the book of Neil Friedman, Case Reviews in Ophthalmology. This book is a very nice book that will review the different clinical cases scenario in the format of questions and answers, the same way the exam looks like. So will be a very valuable tool for your preparation for the FRCS Glasgow Part 2 and even for Part 3. And let me just stop here for one moment. Many of you may be frustrated from the final decisions called out by the Royal College of Surgeons of Edinburgh and the International Council of Ophthalmology. They may feel that this end of collaboration is just unfair for them. They already cleared the clinical ICO, the advanced 115, and they were expected to apply for the advanced 180 to be eligible for the FRCS Edinburgh exam, the final Viva and OSCE. However, because they were unlucky that this collaboration has ended, they were now unable to do so. So, what is the alternative? Is problem solving a good alternative? Well, If you think about it, like we are substituting the advanced 180 exam with the problem solving exam, so it is just one exam instead of the other, and you will just you will just apply for the FRCS Glasgow instead of the FRCS Edinburgh. It will be much relieving. You will now it is not like you increased the number of exams over your shoulder, but it is like one exam in trade of the other. But again, you may think, but again, it is not fair because the advanced 180 it is just an MCQ exam, while the problem solving it is more demanding exam. It requires some clinical experience. It requires having a lot of clinical exposure through books or through practice, and also the part of emergency medicine. So, is it true? Well, I will be honest with you, it's true. But think of it like in another way. Those who had the advanced 180 exam didn't study the clinical approach for ophthalmology. They didn't expose to clinical case scenarios, and then when they are applying for the FRCS Edinburgh, they will start all over again. All over. So they will have very rough time to study everything, either for clinical examination or for viva or the oral discussion. So they will cover all this. They will study everything again. It is not that they escaped with advanced 180, but it will be, sorry for those who had the advanced 180, but I'm just being honest. But actually, yeah, they will have to study all this, and actually they will study it for a more tough exam, which is the FRCS Edinburgh Viva and OSCE. But look at you. You are now studying the FRCS, the clinical books, the clinical approach books at your own pace, and you are at your more comfortable. You are not stressed because this is not like an oral and the clinical exam. It is just a piece of paper, or you are now doing it now on laptop because it is an online exam. So you will study these clinical scenarios at comfort, and it will not be a stressful issue for you. And look at your condition after you finish the FRCS problem solving. What will happen? Well, you'll apply for the FRCS Glasgow. The good news is that you don't have to study all this again. You will just need, like, for my opinion, it's just 1 month to master the clinical examination techniques, and you are ready to go for the exam. However, your colleague who had the advanced 180, he will need at least 6 months of study to study all these books and study everything. So eventually, everyone will study this, but you just divided them into 2 sessions or 2 diets. In the problem solving, you will study for the theoretical part, which is for oral discussion, these books, and then after the exam, after the problem solving, you will study it for the problem solving, for the clinical part, or you will study just the clinical examination books. So that's why those of the Royal College of Surgeons of Glasgow, they made experience eligibility criteria for the second part. Like, you should have 4.5 years, but you don't have to have any excess experience or any further experience after that. You just can apply for the FRCS Glasgow Part 3 with no more experience, because they know already that that you studied the books that you need. You already have the clinical experience you need for the FRCS Glasgow. Okay, so this is just important. This wasn't a moment, not exactly a moment, but I thought that this will be very important to say, and very, very important to tell you, to reassure you about this exam. The third book which I recommend was another book. Let me tell you something. When I was in residency, when I applied for this exam for the first time, actually it was the first and only time, it was like in the old format. So I studied from the Wells Eye Manual. This was like the gold standard book for this exam at that time, because the Wells Eye Manual is constructed in the same way how the exam was asking for at that time. which is the workup. So how to work up a case of keratitis, how to work up a case of intermediate uveitis or posterior uveitis, and so on. How to manage a patient with trauma. All these, how was how the Wills Eye manual was written, and this is how we need to write in the exam, or how did we use to need to write for the exam. But nowadays this is not the case. The exam is consisting of short questions, and you need to address each questions separately. So how can we, do we still need wells? Well, we can need well for just for reference. Like if you have a question that asks specifically for a differential diagnosis that you don't recall, or you don't know, and it was not covered in the case review books, then you can refer to it. But it is not needed that you will cover it from cover to cover, or you don't need to go to it or study it thoroughly. Okay, so what is the replacement? Well, since the questions are now short questions, so actually there is a little disadvantage about that, that they now tend to ask about some theoretical knowledge. So they may be asking about some risk factors, some advantages or disadvantages of a certain technique, and these were not covered in the review books, or maybe they are not covered in the workup book, because this is like a theoretical knowledge. So you need to supplement your study by some theoretical knowledge, and the best for that will be the Wong book. So all those attended the FRCS final exam will know the value of the Wong book. This is again the gold standard for the final FRCS, and this is originally intended for discussion of the oral exam. But you will find it very useful for this kind of questions appearing in the problem solving. And again, if you think that you are adding extra book, no, think again. This was just a replacement for the for the Wills Eye manual. And again, when you study it, or you study the certain parts of it, you don't need to cover it the entire book, or you don't need to study the entire book. But if you studied it well, you just removed this burden from you when you apply for the FRCS Glasgow Part 3 or the final part. So you can see it is like a win-win situation. You are a winner in all occasions. Any study that you study, it is just an asset for you. It will not be harmful. It will be just boost your success and boost your performance in either in the problem solving or in the clinical. And let me tell you something, that actually it is like both sides of a single coin, the problem solving and the FRCS Part 3. If you just check the regulation file of the FRCS Glasgow, they will tell you clearly that what they ask in the Part 2 and in Part 3 are your ability to solve problems, or your problem solving skills. And this is assessed in a written format in the problem solving exam, and assessed in oral format in the final FRCS Part 3. So you can see that they are the same topics, they are the same thing, and the same study, so the same everything. So you are just studying for once, and this study for once will cover you any exam. Okay, so just bear that in mind, that these are the FRCS Glasgow Part 2 and Part 3. They are not separate exams, they are just the two sides of a single coin. Okay, what about the emergency medicine question? Well, the emergency medicine question can be addressed by the Oxford Handbook of Ophthalmology. This is with the standard book for emergency medicine. It was summarized, or the emergency part section is summarized in a very nice way by these notes by my dear colleague Dr. Walid Badr, and you can study from them. And the most importantly will be the problem solving Q banks, or the past candidates experience. So what are these kinds of experience? Well, for any kinds of exam, the most important resource for study will be how is the exam looks like in the previous years. So this how you are getting familiar with the nature of the exam. And let me tell you something, that we already have huge study questions or we have huge questions banks for the problem solving. We almost have the questions of the last 10 years, because this is like a single paper of the exam and it is very easy to recall them, recall the questions after the end of the exam. But please bear in mind that you will find a lot of past candidates' experience. You will find a lot of candidates' answers as an attempt to these questions. Some of them or most of them will be correct, of course, but you need to know that they don't have to be 100% accurate, because you don't know if this candidate has already passed the test or not, and you don't know if their answers are missing some important information. So relying on the past candidates' experience or previous solving of the questions alone, it is not a good idea. But you rather need a more systematic approach for your study. Not to mention that these questions doesn't have to repeat all the time, as I'm going to show you now that the last exam of the March 2021 was not repeated. The clinical ophthalmology scenarios didn't repeat. So don't just gamble over your future and depend on these questions alone. These are the most important source for preparation, but they are not the only source for your preparation. Okay? Okay, let's start now about the how to, these are the books and the different resources that you may need for the exam. And again, I'm stressing on that they should not replace your clinical practice, but this is an addition to your clinical practice. Okay, so let's say now you are applying for this exam and you are now you want now to answer or attempt an answer for a question. There are 3 golden rules, and again let me tell you something, that these are the same golden rules that I use to tell my candidates for the final FRCS. We have 3 magic words, 3 golden words that will be very important in your exams. Either you are solving a written exam in the problem solving, or if you are discussing a case scenario with the examiner in the final FRCS exam. So what are these words? These words what will make your answer looks professional, and it makes you acquainted with the British system of the or British mindset of addressing the clinical scenarios. These words are plan, counsel, and refer. So how to plan? If you are in the setting of the FRCS Glasgow Part 2, well, one of the common mistakes that candidates do is just to rush to answer. Just they hold the piece of paper of the exam or look at the clinical scenario in the laptop in the online exam and start writing immediately. And they are thinking that they are saving time by this means. This is totally wrong. You need to give yourself a break. You need to plan your answer ahead. You need to brainstorm your ideas before attempting the questions. This will save you a lot of time and save you a lot from many mistakes that you may do in the exam. So whenever you have a question, just read the question and give yourself 5 minutes. These 5 minutes are very precious, and write some notes. Write some notes. If you are doing a written paper, just write some notes in the paper. If you are doing the exam online, this will be much easier now. If you are writing some notes in online, and then erase them after you are just storming or brainstorming your ideas. So what are these notes? These notes will be just the headlines of your answer. So if you are just asked about anything, you should put your answer in certain bullets or certain points. These points you will make the frame of your answer, and then you will fill under these points so that you will not miss anything, because it is not uncommon because of the stress of the exam that you will forget many things, And if you are just organizing your thoughts at the beginning of the questions, you are more likely to remember everything. So plan ahead your answer. Just give yourself like 5 minutes before each question before writing the answer. The second is counseling. Well, will be like very important aspect of management that is maybe neglected by some of us in our hectic daily life practice, and because we just jump to treatment, the medical or surgery, and we just forget to counsel the patient. For example, if a patient comes to you with a giant cell arthritis, and you just jump to ESR and C-reactive protein and doing order temporal artery biopsy and order the pulse steroid therapy, but did this will save the patient's eye? This will be the simple question that the patient may ask you. So you should say, or you know that it is not for saving this eye. It will be to prevent the same process to happen to the other eye. But you simply didn't tell the patient that. This is a huge problem. So counseling is very important and very integral part of your management. And when you write it, your answers looks professional and makes you gain more marks. The second thing is the referral. We are not working in isolation from other specialties, but we are working as a team, and so that whenever the patients need some referral or needs consultation, you should do so, and you should write that in the exam, in the written exam, and you should also mention that in the oral exam in the FRCS. So this will be like a combined session for the written and the oral exam. Okay, so you should also mention that, like if a patient has peripheral ulcerative keratitis and you want to refer the patient to immunologist, or if the patient has giant cell arthritis and you want to refer him to a cardiologist or a rheumatologist. So this will be like you write a referral note, or you will write who will you refer the patient to and for what. Like are you suspecting that the patient has vasculitis? Are you suspecting that this patient can develop any systemic problems? Again, treating the patient as a whole, not his eyes alone, is what they ask for in this exam. Okay. Okay, so let me give you an example of how a management will look like. And before I'm telling you how is the management look like, let me just stress on certain words that appear in the exams, and you need to know what to write in them. Like if they are asked about management, then they want they want you to discuss everything, starting from the history till the follow-up. So you will ask you will discuss the history, then the patient complaint, the patient symptoms and signs, and the clinical examination, the investigation, the differential diagnosis, the treatment, the follow-up, and so on. So you are just mentioning everything about that. This is unlike if they are asked about diagnosis. If they are asked about diagnosis, then they are meaning that you should mention what are the some clinical or some history, the history that may give you a clue for diagnosis. You should mention what are the symptoms and signs, clinical examination, investigations, and differential diagnosis. So this is what is meant by diagnosis. So basically you write everything except for treatment. If they ask for treatment, just go for treatment, nothing else. Okay. So differentiate between the management, diagnosis, and the treatment. So this is how a framework looks like. Let me just give you an example. Do you know the IELTS test or the OET test? These are professional English tests. And if you asked most of the candidates who had done these tests, what is the most specific difficult component of these tests? Like, is it the listening or the writing or the speaking or the writing or the reading? Which specific subtest is the most challenging or the most demanding? I believe that most of them will say it will be the writing. Because why? Because the writing has to be followed by certain rules, and has to be, you are productive it is not like the reading or the listening. You are producing words and connect them into sentences, and you have to follow some rules for the vocabulary, for the grammar, and then you should choose the correct choice of words. So they find this will be the most difficult, and that's why it will have certain rules how to write for an English test. It will be like doing certain paragraphs, like 3 or 4 paragraphs. The first paragraph is introductory, then 2 supporting paragraphs, and the final will be the conclusion paragraph. And even the paragraph has a certain structure, starting by an introductory statement, then supporting statements, and conclusion statement. So it will be like a coherent structure. Well, it is the same thing for the writing, for problem solving. You have to follow certain rules or to have a certain framework for your answer. If you are doing this, even if you don't reach a diagnosis, you will get great marks, because this will be the same like our clinical scenarios in day-to-day practice. You don't reach a clinical scenario in each time. Otherwise, why would you order investigations? Why would you order histopathology? Because you don't know the diagnosis each time just from the clinical symptoms and signs. And this is the same for the exam. Maybe when they are asking about a differential diagnosis or a scenario, they don't want you to reach a specific diagnosis, but they need to know how do you think, how do you analyze the questions, how do you reach a differential diagnosis, and how can you differentiate between them. So this is what is required for this exam. And sometimes you may tell, but I have no clue about the exam, no clue about the scenario. Just put the scheme, put the framework, and you will gain marks for this framework. So the same like you gain marks for the writing exam in the language tests. So what is this framework? You will start by history, starting then followed by examination, systemic and ocular, and then you will order investigations. And this is, so for the history you should analyze the patient's you should take the patient's history, like personal history, the past history, the family history, and whatever anything in the history is relevant to your diagnosis. And let me tell you something, that when you are writing in the exam, you are talking in the in like as if you are discussing to your colleague. So you will say, I will ask for like A and B and C. I will do A and B and C. If I found A, then I expect B. So this is like you are explaining to the examiner, so that you are this gives the impression that you understand what you are saying or what you are writing, and you already did that in your clinic. Okay, so when you reach the clinical examination, you will tell that I will examine the anterior chamber. Like for example, if the patient has a trauma, if the patient has had trauma, you will say, I will examine for example, starting from outward, I will examine will record the patient visual acuity, uncorrected and best corrected. After first exclude any serious conditions, like if the patient had subdural hemorrhage or extradural hemorrhage or subarachnoid hemorrhage, then you don't go for the clinical examination for the eye now. The patient has a life-threatening emergency. So systemic conditions should be covered first, then the local conditions, like the ocular examination in the form of you should record the visual acuity, uncorrected and best corrected, like to exclude like cases of traumatic optic neuropathy or retinal detachment or any other problems that may cause drop of vision due to trauma. Then you will examine the eye, or like a systematic examination for the eye, starting from the extraocular muscle motility. You may find like restriction of motility because of blowout fracture, for example. When you are examining the intraocular pressure, you expected that there could be like hypotony if there is laceration or if there is perforation. And then examine the anterior cornea for presence of corneal wound, sclera for scleral wound, conjunctiva for subconjunctival hemorrhage, anterior chamber for hyphema, lens for dislocation, iris for iridodialysis, vitreous for vitreous hemorrhage, retina for commissure retini, and so on. So you just put the items. When you put the items, you will remember how to fill these items. So this is again the importance of having a frame to put your answers in. If you don't have the frame, you don't have the answers. Like there is a common saying that will say, the eye cannot see what the mind does not know. If your mind is not aware of a presence of certain lesion or certain problems, then your eye will not appreciate it. This is for clinical examination, and this is also for the exam itself. If you are not minded by by what a trauma can affect to the eye, you will not be able to fill in this information. However, it will make you easier to remember if you just put the items. If you make the items that you are checking, it will makes you a lot easier to think how is this system or organ or tissue is affected by the kind of pathology described in the exam. Okay. And the important thing then after doing complete ocular examination, then you should order investigations, and the investigations should be only the necessary investigations, because actually you are doing a British exam, and in the British system they don't overuse or misuse the investigations. So they only order the relevant investigations that they will be helpful to either reach a diagnosis or exclude a differential diagnosis. Let's say, for example, if you have a patient with proliferative diabetic retinopathy, so you can order him fluorescein angiography and OCT scan. But if the question is saying that you have a clear fundus view, will you order ultrasound? This will be unlikely because you have a clear view, and this will be a waste of resources. So bear in mind that in the UK system, all investigations are covered by the insurance. So the healthcare system doesn't want to overload the insurance system with unnecessary investigations. So you have to be cautious or be conservative in investigations. So the rule again in the FRCS problem solving Glasgow or in the FRCS final part is to be conservative as much as you can in the investigations and the treatment, and to be very, very, very generous in history and examination. So I tend also to say that for my FRCS part 3 candidates, try to ask as many questions in the history as possible. Try to thoroughly examine the eye for every single detail. But when it comes to investigations and treatment, just be more specific. Just give the patient what he actually needs. Okay? So after doing the investigations, just now go to the treatment. And for the treatment, start by counseling, as we mentioned. Start by writing like 2 or 3 lines about that you will counsel the patient about his condition, and you're discussing him the prognosis of his condition and what will be the effect of the treatment and what does he should expect from the treatment. And then you should also think FRCS. How to think FRCS? You should exclude the most dangerous and the most common. Like for example, if you have a patient with a third nerve palsy, and then you should exclude the most dangerous after doing the MRI and the MRA. Just exclude the presence of a tumor or a presence of intracranial aneurysm such as posterior communicating artery aneurysm, or exclude the trauma. So then you should now discuss anything else. So patient life is your first concern. Actually, our first concern in ophthalmology, it is not save the patient's eye, it is save the patient's life. And I encourage you all to watch my lecture. If your patient dies, if you skip his eyes, this lecture will cover almost all emergencies in ophthalmology. That like the examination, the diseases that emergency may happen due to some sort of investigations like fluorescein angiography, like some surgical procedures, some anesthetic procedures, all the kinds of emergency that may happen, that life-threatening emergency that happens to the patients, which you may not notice because you are just treating the patient's eye. So you need to address the patient's emergency in a life-threatening condition. You should do any acute management if possible or if required. Then you should think about what is the most common cause of this lesion, and then think about the related lesions or related pathologies, associated pathologies, and always avoid lateral thinking, avoid eccentric thinking, avoid to think of remote differential diagnosis that were maybe not very correct for this case. And finally, don't forget the referral. Don't forget that you will co-manage the patient with other specialists, with other consultants, and don't forget that you should write a referral note for these for these other specialists. Okay. So let's come now to the actual exam. So I'm going to present you this exam, which is the October 2014 exam, which is almost the last exam with the old system, so that you can know how is the old system is formatted. So they tend to bring you a scenario and ask you about differential diagnosis and the management. So a scenario about trauma, a scenario about uveitis, a scenario about like toxic optic neuropathy or optic neuropathy, and ask you about assessment and management. So this was how the exams in the past look like. So as I told you, it has advantages and disadvantages, but now this is the last exam. This is the last March 2021 exam. So you can see how the questions are more spreaded and more detailed into specific points or specific questions. So they ask about specific things that we need for this exam. So like they ask about diagnosis, ask about investigations, management, ask about follow-up. So this also has or the exam has also some theoretical knowledge, like for example this question about a female with rheumatoid arthritis, and the physician is going to start with the hydroxychloroquine. So the question asking about what are the risks of using this drug. Well, in the older system, you are not likely to discuss the risks of chloroquine if you are going to discuss a management of a patient with hydroxychloroquine maculopathy or toxicity from hydroxychloroquine. But now the exam is asking specifically about that. That's why I'm telling you that your theoretical knowledge is also important. Also, it's asking about different investigations with their advantages or disadvantages. So whether you are ordering this patient's microperimetry or OCT, there you also should have an idea about what are the limitations of these investigations. And this also you are unlikely to discuss this if you are in the old system, but now you should discuss this. So again, it is not like it is only workup now. It is a workup with some supplementary questions or some complementary questions that you need to address, and they are easy questions that you can gain from, or you can gain the knowledge about from your clinical practice or from reading the books. And the final question is the emergency medicine question. You can see how is the emergency medicine question is divided into 6 questions. This is just they want to make you gain marks. Like if you just answer 3 questions and left 3 questions, you will still have you can still pass. So you can still pass this problem solve. You can still pass the emergency medicine, and you can still pass the whole exam. So actually when they are dividing the scenario into different small questions, they are actually helping you to make you able to gain more marks. Okay, now let's come to my success tips. So I will share you some tips that I will find useful, and I tend to tell them to my candidates. So I hope that you will find them useful. The first of all is time management. So this exam is not like a one-night stand, like you are just studying overnight and you are going to the exam and you will pass. No, doesn't work like that. And with all respect, it is not like the ICO exams. Like you are just studying previous papers MCQs, and they are repeated in the exam. And I know some people who passed the ICO exam from just 1 week study. So they just memorized the past papers. But this is not, this is a real test. And it tests your real knowledge and your real skills. And actually these real skills are crucial for your development as an ophthalmologist. So actually your study is what is making you a better ophthalmologist. Actually nobody is going to be a better ophthalmologist from studying for the ICO exams. So you need to plan your time wisely, starting as early as possible. And this is like a question I always face. They tend to or ophthalmologists tend to ask me, how much time should I give for the exam? It is a month, 2 months, 6 months? Well, my answer, it's always depending on you. Like as I told in the UK ophthalmology exam, the blueprint lecture, if you are just not a very hard worker, you have very tough commitments, you have a busy work schedule, you can't give much time to study, then start as early as possible. Because if you are just studying 2 or 3 hours per day, then you need around 5 to 6 months. But if you are a hard worker, if you are dedicated to your study, if you don't have much commitments, so you can like give 6 to 8 hours per day for your study, well, then you are a champion, you are a hero. So I congratulate you first, and I wish you the best. And I will tell you that you only need like 2 or 3 months study for this exam, of serious study for this exam. This is if you are starting from scratch. But if you already have some previous knowledge, if you already read the text once, like read Kansky once, or read the American Academy series of books once, then you should take much less time than this. Okay? So this is what I mean by time management, good time management, because good time management will make you gain more marks and will make you accommodate the huge amount of knowledge faster, and will be good for your nerves, that you don't get stressed before the exam. Okay, so you may say that, but I don't have time, my work schedule is very busy, and I have a lot of commitments, so I can't dedicate some time for study, so what can I do? Then I will tell you, make good use of your time at your clinic. Like if you're spending a lot of time at your clinic, well, you have a treasure, and this treasure is a lot of clinical cases that can appear in the exam. So how can you benefit from them for the exam? You have to accompany a book. You have to bring your book with you, like Will's Eye Manual, and at each case or whenever there is an opportunity, you can open your book and study the case, like to read the case and see how did you manage it, if you manage it according to the guidelines or not. And not only that, but you can also discuss the case with your colleagues, and this will be the best thing for your exam and for your practice. Actually, in the exam, you may forget some information written in books, but you will never forget a case that you saw. For example, you will remember a case of hyphema that you saw the last month, and you managed it by ABC, and so you will know how you manage, and this will make you remember in the exam. So this case discussion are very valuable, and actually in the exam itself, when you are trying to write the answer, you are writing it in the same way you are discussing it. So if you were to if you want to attain good marks in the exam, try to discuss the cases at your clinic, and your junior staff will love you. Okay, so the third thing, or the third tip that I'm advising you is to solve the questions from day one. One of the major mistakes that my candidates do when preparing for the exams is that they are stuck. Why they are stuck? Because they are stuck in here. They think that they need to understand everything and have all the study resources and collect all the books in order to start. No, this is not correct at all. You need to start whatever the consequences. Like studying is like a skill, and this skill improves with time and improves with practice. If you didn't start and you will not improve. Like as if you are watching a surgery from the side tube and you just don't have the gut to be a surgeon, to take steps in the surgery. How do you expect that you will improve? The same thing applies with the study. These study skills are doesn't have to be perfect from the start. You don't have to like study like 50 or 80 pages per day from day one and understand and memorize everything you studied. This doesn't happen from day one, but you are just escalating step by step until you reach your studying fitness. So it's like a gym. So what happens when you are starting from the day one? You start by you hear the advice of Dr. Ahmed, and you now open your books. So you open the questions, the previous papers, and you face the first scenario, and again you are stuck, and you see that you are totally lost. You don't know anything about it, and you can't even write a single line about it, and you now in the failure to launch syndrome. You can't just launch your study, and you are totally lost, and you are frustrated and depressed. So why does this happen? Because then the tip number 4, although that solving questions is very important to get familiar with the exam, but you don't assess yourself from the start. Like the questions banks are used as as an educational tool, not an assessment tool. So you are trying to when you have a question, you don't be perfect, or you don't answer it perfect. Just answer it like in a line or 2 or 3 lines, no problem at all. But meanwhile, try to bring the best possible answer for this question. Gather your study resources, whatever material do you have, and try to write the best form of this question that you can have. Then you are studying, and then you are learning, and so by trying to do this many times, you are now improving your writing skills, and also improving your studying skills. And as you go, you will also need to do the tip number 5, which is taking notes. I always advise my candidates to take notes for whatever exams they do, because actually according to learning science, we are different according based on how we acquire the knowledge. Like some of us are visual, they tend to learn by vision, they need to watch lectures, and actually this is the most capacious study learning tool. Some of us are auditory, they tend to hear lectures, so they love to listen to lectures while they are in the gym, while they are walking to the hospital. Others have the learn by writing, so in order to remember something, they need to write. And actually, in order to give yourself the highest chance of acquiring the knowledge, you need to acquire the 3 modalities together. You need to watch lectures, you need to listen to lectures, and also you need to write, and also watching books. So some of us have this visual memory that they can remember where are the certain topics within the books. So combine the 3 together, and actually let me tell you something, that your hand has a memory. When you are in the exam, your hand will remember what does it wrote one day. So don't neglect this crucial rule for your hands. And the most important thing about taking notes, that you will focus only on these notes before the exam when you don't have time. So before the exam, the few weeks before the exam, you don't have time to revise everything. So what you will do actually is revising your individual handmade notes. Okay. Number 6 is to have a mentor or tutor. So it is the same again like the language test, like the IELTS test. When you are doing the writing test, so for those who will complete the FRCS and will apply for GMC registration, they will be required to do the IELTS test or the OET test. And in the writing test, if you just trying to write the same thing In the same time, every time you will repeat the same mistakes and there will be nobody to correct you. So actually you are wasting your effort. So, and the same thing with the speaking, by the way. If you are speaking without someone to correct you, you will repeat the same mistakes. So eventually we are, as an ophthalmologist, we acquire the knowledge by learning from those who have more experience than us. So actually there is a wise saying regarding the FRCS exam is, if you wanted to be a fellow for the Royal College, you have to follow. So you have to follow the advices of those who had more experience than you. You have to follow the advices of the previous candidates. So they will know better, so they will advise you in order not to make the same mistakes that they did. And this tutor can be a senior resident at your hospital, can be a consultant, can be a professor, can be someone you trust, it can be a tutor or a course that you, or a coach, so whoever, but you just need your answers to be corrected. You need someone professional that you trust in order to try to check your answers and know what are the mistakes that you did, so that you will not repeat them again. Okay, the tip number 7 is to take time before the exam. So don't just go to work till the last day of the exam. This will make you very stressed before the exam, because the days that you are off from the work are the days that you are the most productive, the days that you can study very well, you can study larger amount, and you can accommodate larger amount of knowledge. So try to have a day off or have a vacation or have time off before the exam as soon as possible. Number 8 is the stress management during the exam. Actually, let me tell you that stress is your number one enemy. So the stress will make you lose marks, because it will make you forget things that you studied by heart. So you have to fight this enemy as much as you can, and this will maybe we make a lecture for how to manage stress, but just generally speaking, all the kind of tips that we just discussed will make you overcome the stress. If you planned well, if you prepared well, if you did your good time management, if you took notes, then you are familiar with the exam. You are just writing the exam, writing the questions that you already practice a lot. So practice makes perfect. So these are my tips, my 8 tips for the exams, for the problem solving exam, and for also the FRCS exam, the final part. I hope that you will find them useful. Finally, let's talk about the problem solving course and how can we support you through your study for this exam. Starting, let me just introduce ourselves. So who we are. We are iCourses. We are an online ophthalmic academy for ophthalmic education. We are very specialized in the postgraduate ophthalmology exams, specifically the UK ophthalmology fellowship exams, and we were established in 2014 and started by many courses for different UK fellowship exams, including the Royal College of Surgeons of Glasgow, Edinburgh, London, and the ICO. And since 2014, we have been fortunate to tutor more than 2,000 ophthalmologists from more than 700 or 70 countries all over the world. So actually, our lecturers are here almost over the entire of the half of the earth, and I am very happy for that. So during that time, we have been introducing many courses, so to cover every single aspect of the FRCS and FRC of the exams, and we are very happy now to introduce the problem solving course. So the problem solving course consists of 20 lectures. So these 20 lectures will be 2 lectures per week, and they will be conducted on Monday and on Thursdays. They will be live on Zoom, so they will be live interactive classes. Start date will be the Monday 26th of June 2021, and it will be conducted over 2 periods or two sessions. First session will be for the English group. This will be like English speaking group, and the second one will be an Arabic speaking group. So just to think of it like we are already lacking or running out of time. The exam in the 6th of October, so 20 weeks is just almost all what is remaining before the exam. And if you think about, if you have never started or you are starting from scratch, we are just giving like 1 week for each topic. So I'm going to present to you the topics. Here are the topics like the neuro-ophthalmology, pediatric ophthalmology, corneal, lens, lacrimal, glaucoma, uveitis. All these topics will be covered in 20 weeks. So it will be 2 lectures for each topic. And this will be like you have 1 week, entire week for studying the topic. And this will be more than enough for studying the topic and the questions related to it. So I think that this will be your last opportunity. If you haven't started yet, well, this will be your last opportunity. Just to start now, just to take the decision. You are losing very valuable time. And let me tell you something. There is also a common saying for the exams, the FRCS exams especially. It's called that if you want to, the easiest way, the most rapid way to fail is to study alone. Just don't be alone. You don't walk alone, because walking alone will make you tend to procrastinate, tend to delay your study, to postpone your study, and you are not making a progress. And not making a progress will make you get frustrated, and you go into a vicious circle. So just start by today. It is never too late, but it is today. You have to take a quick action to enhance your progress or to develop your career by passing this exam. After the classes or after the live classes, we are introducing our dedicated mobile application, the iCourses mobile application, which will be like you will be able to access your account through the mobile application. You will be able to watch the records of the lectures till the day of the exam. So rest assured that you don't have to worry if you miss the live class. You still can compensate for it through the recordings, which will be available with you 24 hours, 7 days a week until the days of the exam. So you will be able to study at your own pace, at your own schedule. And also the mobile application, it has the feature of download the lecture, so you can download it to watch it offline later. So for those who have poor internet connection, we managed this problem, and so it is with just at a click of a hand you will reach all the knowledge that you need. And also, let me give you some good news. Starting from this course, we will introducing something new, because I know how much this exams needs dedication and they need hard work, and all of us get busy in their lives and just forgot to study, or just maybe watching a lecture and maybe the other is not. And depending on that, these lectures are available and the records are available. They are not encourage you to attend live classes. I am used to that, but I will try. I had an idea, and this idea is to encourage you, to motivate you in order to attend live classes and in order to succeed in this exam. Actually, this is what I need. What I need is only the serious candidates who are very dedicated, who are hard worker, who I can exert effort with them in order to help them to pass this exam. So I'm giving you like what's called a homework. Yeah, you are returning back to school, where you are having a homework. What is this homework? This homework is simply a question or a clinical scenario where you trying to attempt in your home. So after we finish the one chapter or one section of the exam over 2 lectures over 1 week, then you will be able, or you are required to solve a question and return and send it to us, so that we can check your answer and tell you what are your mistakes, so you can improve. And Not only that, but it will also give a different question for each candidate. Of course, this will be difficult for me because I'm going to correct all these, but I'm doing this for you because I believe that this will be very essential and very crucial for you to gain knowledge and to consolidate the knowledge that you acquired from the course. And not only that, but we also will discuss these answers in the next session. Like if we had this week of the neuro-ophthalmology, you have your homework of neuro-ophthalmology of a case, you will write it and you will send it to us. So we will discuss it over the group. And don't to be embarrassed that we will not mention your name, of course. We will just present the different answers and different questions and discuss what are the mistakes that you did and how can you improve without saying any name, because this is not our target to tell names. It is our target that you will improve and to your commit to the study. And also you can consider it like a practice. You are writing a question answer on the laptop, and this is the same thing that you will do in your exam. So if you practice doing the approach, writing an approach and then doing it, it will take you 30 minutes over the whole week. This is not so much to give for the sake of your future. So not only that, but also we promise those who will be dedicated and committed to send us the 10 homeworks or the 10 questions, and with their answers there will be a prize at the end of the course. So there will be a prize for those committed candidates who attend all live classes and bring us all the lives solve all the questions that we bring all over the entire 10 weeks of the course. So what is this prize? It will be a surprise. So this will be a very tremendous effort. Actually, it is over me because this is like solving the whole group different questions. Actually, let me give you an example. Actually, I got this idea from the IELTS test. Those who are giving IELTS courses, an essential part of the course is to correct writing tasks. And those IELTS instructors, usually they correct these tasks for like $20 per task, for the single task. So if you just think of it, you will find that the real value of correcting your tasks, it is the same value of the course. Actually, this is a bonus that you will be able to benefit from if you just subscribe. If you are serious enough to proceed forward for your career, and you subscribe just before the timer is hitting 0 before the course start. So if you take a decision, then just try to contact us at our contacts here. You can find our email, you can find our WhatsApp. So we have a very loving supporting team. They would love to help you to in whatever concern that you might have, either with the exam or either with the course itself. And I wish you all the best of luck. I wish you all the best of success through the exam and through your career. And I hope that in the exam you will be able to solve the puzzle and to be able to know how to put the pieces together in order to construct a very good problem solving. And this is what we will help you about. Thank you very much, and I will see you in the first session of the course.